So I'm just going to ask this last question. We'll just touch on it. Can you give us guidance about the drugs? I'm not going to be able to pronounce this, so I might need some help from someone. Hydroxyquinone, and the controversy around these malaria-esque drugs, antiviral drugs.
I'm just going to invite, since we have Dr. LeRoy here, and she's talked about this the last few times, I'm just going to get her to come and talk about it, give the medical perspective to that answer. So can you unmute Andrée, please?
Yes. So Andrée, welcome. You're unmuted. So I'll just repeat the question. Can you give us guidance around these antiviral drugs? There is so much controversy around these. And I know we only have a minute for this, but maybe you can just give us a little bit of guidance there.
Yes. So yes, there's a lot of controversy, especially given the origins of some of the investments in the medications. However, what's coming into awareness as of late, there was a recent study that was done at the Veterans Administration Hospital for critically ill patients. In that study, it was 384 patients, as opposed to the previous study that was done, which was in France, with a much smaller number. They actually saw a higher mortality rate in critically ill patients who were elderly and taking the medicine. That being said, the anti-malarial medications have been used for a number of years, have been very well tolerated in younger people, and can be considered as an option if you are someone who is wanting to avoid hospitalization. Same thing goes for the antiviral medications. Because the virus in this current form is so new and the experience is new to all of us, a lot more concrete information will not be available until later in time. And so people have trialed multiple different antiviral medications with mixed results. That being said, my encouragement is for you to check in inside and use your own discretion as to which feels the most aligned path for you to take, understanding you can change that at any moment in time.
And just to set the context, Dr. LeRoy, contracted COVID, and many of you already know this, but there are several who are new here. And she chose not to go to the hospital because she's a single mother of a 5-year-old and who would have had to be isolated by herself. And she did two things. She also really started communicating with her immune system and became a partner with her immune system, and also partnered with the virus. So the virus could actually, energetically, would be ready to release, and took the medication to support her physiologically. And within 6 hours, she told us last time, her oxygen levels went up significantly. And then she was on a path to recovery from that point on. So make the choice that is the best for you. Thank you. Thank you, Dr. LeRoy.
Yes, and thank you, Mynoo. I think that's enough. That's all the time that we have for questions. So I encourage you to send in your questions next week so we can have some more juicy information to talk about.